Hi everyone, my name is Dr. Samantha Szyska, and today during our video we're going to continue with going over pain during pregnancy. We're going to cover low back pain, where it is, what we can do for it, and a quick change that you can make at home for it. Hi everyone, my name is Dr. Samantha Szyska here at Cornerstone Health. Thank you for tuning in. We're going to continue with our pain during pregnancy series. Today we're going to talk about low back pain. Low back pain is very common, but doesn't mean that it's normal, nor do you have to live with it. A lot of my pregnant patients are like, oh yeah, I've always had low back pain, or oh yeah, it's only 9 months. It's okay. I'll deal with it and then it'll be over. It's not true. You need to be able to adapt during those 9 months. You should enjoy your pregnancy and not be in pain during it. So what we're going to talk about today are some common issues that arise during low back pain with pregnancy, and then we're going to give you some ways that you can help relieve it at home. Here in our clinic, what we look at when our patients come in, we do a thorough examination, and then what I look at is I'm going to see what is the cause of that low back pain. Is it neurological? Is it structural? Is it postural? Are your hormones? Because as we're growing, our hormones are changing. As our stomach is increasing and the belly is growing, as your baby is growing, your posture is changing. A lot of individuals will change their workouts during pregnancy. We want to help you moving better so you can enjoy your pregnancy, and also so you can have a good postpartum healing process. Okay, we're going to go over some common areas of low back pain, and we're going to give you a quick little exercise and an adaptation that you can do at home. We have our great model here today, PQ. So we're going to first show exactly where low back pain is. So I'm going to have you turn. So low back pain is very common, but everyone has a different definition of it. From my definition, I'm looking a couple of inches below the scapula to about the top of the glutes or the belt line. Most common within my pregnant population, I hear it's right above my belt line, kind of at the beginning of like the glutes and the gluteal area. It can wrap around to the front of the hips, it can go down into the glutes, or it can go up into the back. But mostly it starts right through here. I'm going to have you turn around. So whenever I see a lot of my patients with low back pain, especially they'll say when I'm lifting to pick something up, whether it's laundry, whether it's groceries, their other children, a backpack at work, I always say, let me see how you lift and pick it up. A common way that a lot of people will lift and pick things up is they'll lift down, so I'll have you lift down and they round excessively through their back. When they go to stand up, they use their back muscles to do that. We want to make sure that you're using your leg muscles. Your leg muscles, your glutes, your hamstrings, your quads are way stronger than the muscles, these strappy muscles that run across your back. So an exercise in a way that you can check at home is see when you're lifting your child, the laundry, take a look in the mirror. Are we rounding? Are we doing it through our glutes? Do you feel it in your back? So one of the ways that you can help is to learn how to hip hinge. There are multiple ways of learning how to pick something up. It's either through a squat or a hip hinge. Today we're going to go over the hip hinge. This is like when you're lifting something out of the oven, brushing your teeth, washing your face, lifting something that's not quite on the ground but a little bit off of it. So to learn for the hip hinge, PQ's doing a great job right now. She's going to have her feet a little bit wider than shoulder. We always want to do everything in an athletic position. She's going to have a good stance on her feet with the floor, so she'll have a good spread into her toes. You don't want to be up on your toes, back, or on the outsides. You want to have a good equal weight distribution. Her knees are going to be right over her second and third toe. We don't want her knees bowing out. We don't want them in like that. We want a good stable base. When you buy a house, you always check the foundation first. We got to make sure we have a good foundation. Perfect. So now, as we said, it's called a hip hinge, or in our weightlifting world, a deadlift, if you're more familiar with that. The majority of the motion is going to be happening at her hips. So she's going to start off with just a slight bend in her knees. Then she's going to pretend like there's a pole right through her hips. So she's going to rotate over that pole. So another common mistake with this is we will bend too far forward, and everyone's like, oh, I feel like I'm going to fall forward. You need to be able to shift your weight back so your center of gravity is in the center. If I go like that, I'm gonna fall forward. We wanna make sure that that doesn't happen. So PQ's doing a great job. Good feet spread, knees over second and third toe, slight bend in her knees. We're gonna maintain a nice neutral spine through here. So she's gonna tuck her tailbone slightly. Good, and then she's gonna pretend there's a pole straight through her hips. She's gonna bend right around that pole, shifting her weight back further, further, further. Good, maintaining a beautifully neutral spine. She's gonna feel some tension into her hamstrings and her glutes. That's exactly where you wanna feel it. Then she's gonna push the ground away from her and drive up. Good, not using her back muscles. See how that was a much better neutral spine instead of when you bend forward and you use your back muscles? That you're gonna feel it on through your legs into your glutes. That's exactly how I want you brushing your teeth, washing your face, getting things out of the oven. It'll take pressure off of your back and make you use the posterior muscles to make you nice and strong throughout the rest of your pregnancy. If you have any questions or concerns, if you suffer with any of these low back pains or want to see how can I, it hurts when I do X, Y, and Z, give us a call and let's get you in for a consultation.